Now, but please come closer. And first, I want to show you that what you have is a spondylolisthesis L5S1 and severe degenerative disc disease. And here, especially, you see that in some areas, patient has a rotational of the L5 as well. We are dealing in some areas with a grade 2 spondylolisthesis. As well, I want to show you this here that shows that you have a scoliosis, and I measured it. It approaches 20 degrees scoliosis of the lower lumbar spine. Now, please, let's look back here. Tell me about your symptoms. Pain 9-10, is that right?
Right.
For how long have you had that pain 9-10?
I'd say close to a year.
Close to a year. And you have done injection and it's not helping. Now,
The injection helped a little bit, but not
permanently.
satisfactory.
Yeah, not satisfactory. But you are not overall not getting better.
No.
Is that correct? Okay. So, and you saw, I'm the fourth surgeon you see. What did the first surgeon want to do? You saw.
He wanted to go operate through the front and put some sort of a block in there with a screw in there.
Mm-hmm. We call it ALIF, anterior lumbar interbody fusion. And he wanted to do it in 2 days, right? Tell me about it.
No, 3 days.
3 days.
He said he had a specialist that works with him that goes through the front. When you're in the hospital and you'll be there for 3 days later, I'll come in and then I'll operate through the back.
So he wanted to literally open up your belly, push the guts and the vessels to the side, do the front part, then let you be in the hospital for 3 days and recover, then go from the back and finish it up.
Right.
So practically 2 surgical days.
Correct.
Okay, and to correct the situation. And then you told me you saw 2 more surgeons before you saw me. Tell me about this. One of them was a major medical facility here in Minnesota, right?
Yeah, well, I didn't see him. He just looked at my MRI and gave a report back that he sees no cause for any type of operation at all.
Yeah, and even though you have a 20-degree scoliosis, grade 2 spondylolisthesis, significant foraminal stenosis, and you have pain that is 9 to 10, without even seeing you and examining you, telling you you don't need a procedure.
Right.
Is that correct?
Correct.
You have diabetes, right?
Yes.
And how old are you?
76.
So obviously surgeries can be risky for you.
True.
But he didn't tell you you need a surgery and it's risky. He told you you just don't need a surgery.
Right.
That is unfortunate. You saw another surgeon after that. Tell me about that.
I was a spinal expert, and he told me that he would be less invasive if he had to go through the front, but then he made like 4 little holes in the back, but he wouldn't do any fusion of the 4, 5, and 3, 4, and 5 or something like that.
No, he would go from the front. He would do practically the same thing that the first surgeon told you in 1 day, though.
Correct.
He would go from the front and put those plugs in and fuse it. In the back, he would do instrumentation. He wouldn't make the bone grow together, but he would put screws stabilizing it. And because he's doing a little less surgery, he can do it in 1 day. Did any of them tell you how long that surgery is going to take?
No.
Like how many hours, how much blood loss, and so on?
No.
It's usually about 5-6 hours surgery. And if they are going to do truly fusion from the back, it can be even longer. For that reason, I believe the first surgeon wanted to break it, give you maybe 2-3 hour surgery rather 1 6, 8, 10 hour surgery. Now, and what did the third surgeon tell about the major place that you sent the picture and told you that you don't need a surgery? What did the third surgeon tell you about that?
He said he doesn't understand it. He figures, I don't know how he can give an answer like that without even seeing the patient.
Yeah, I agree with him.
What kind of pain you're in, or something in that order.
That is just not right. Telling you just go live with it. Not even telling you that you need a surgery, but it's risky. This is risk versus benefit. That's what we do as a surgeon. Just looking at your films, looking at your report that you have diabetes, you're older. No, you don't need a surgery. Do you think you can live with the pain you are having right now?
It's not very, I mean, I don't want to die, but I mean, it's something I sure like to get rid of.
Well, you don't have to die. We do this surgery, this OLLIF surgery for scoliosis. For 3 level, our average time, we make a small incision this big on the left side, and we approach the bad disc with the tooth that's barely bigger than that, and we put a tube in, and we take the bad disc out. We put a spacer, and we put the spacer as such that it bends your spine the correct way. Then we put over multiple small incision screws in the above and below, and we do exactly what the first surgeon wanted to do, not what the third surgeon wanted to do, all over those small incisions. So we do fusion in the back and the front, and it takes us literally, our average time for a 3 level is 1.5 hours. Our usual average blood loss for 3 level is about 100 to 150 cc, and our average stay in the hospital is 1 to 2 days. So we can do all of that in that time frame, and it's a doable surgery. We do it every day. We have done thousands of this kind of surgery, and at least few hundred of those on people with scoliosis like you are having. And by us making an 8-10 hour surgery, a 1.5 hour surgery, and 2 liter of blood loss to like a 50 to 150 cc of blood loss, we change the risk versus benefit ratio so much that this surgery absolutely is doable, even in your situation. Not in 2 days, in 1 day, and not a long, big surgery 1 day. It's a much smaller surgery, but still is obviously a surgery. And our job as surgeons is to weigh risk versus benefit and give it to you so you can make a consent decision. Do you understand what the problem is and what the solutions are so far?
Pretty much.
Excellent. Do you have any question for me or any comment?
How will my walking be after that? I'm not going to have to get a walker or nothing.
96% of our patients walk within the first 24 hours independently. Obviously, some patients need a walker and some help to learn how to deal with the new situation. In your situation and with your age group, you may need a little more help to walk independently, but it would be extremely unusual if you're not walking the same day or next day after the surgery. It would be very unusual.
But normally?
Well, normally, sometimes people do need some help, like a walker, depending on the situation. Every person heals at a different rate, but some people do need some help.
What about the options, or not the options, but I mean, I don't like when I gotta get an operation and a while later I gotta go back and they gotta redo something on it.
Well, there's always a risk that we have to go back after any kind of surgery. Those risks has been less than, from 1,000 patients I have done this kind of surgery, it has been less than a dozen that I had to go back and do something. But yes, that's always a possibility.
Okay.
And what as well I want to be sure about, that it's very clear, even though you have a scoliosis, you have grade 2 spondylolisthesis, we are going to enroll you in our inspired spine protocols. Our inspired spine protocol, even though most likely, statistically, you will end up with a surgery, we are going to send you back and get a full course of physical therapy and a full course of other conservative treatment before we do the surgery. Even though, in truth, it's more than not likely with the scoliosis and spondylolisthesis that you end up with the surgery, we will maximize all other treatment, because that's our promise, to do the surgery only if it's absolutely needed. Now the good news is, with us strengthening your back muscle, but after in the surgery not destroying the muscle and the bone, you can keep those strong muscles. Even if you end up with the surgery after our conservative protocol, you will heal faster, because now you have a stronger muscle that we didn't destroy in the surgery to help you recover faster. Now, I'm going to start this process for you, and then I like get follow-up interviews like this to see how you are now, how you were after the surgery. Now, obviously, we are at the beginning of this process, but do you have any other question for me right now or comment?
How long is this therapy?
Usually we send a patient for a full course, which is 12 sessions, but sometimes the physical therapy, after they go through all their modality, they come back to us, they tell us, for the therapy is not good for you, and I should go ahead and proceed with the surgery. But I will let them have the first kind of try to make you feel better.
I gotta check with my insurance to see if that covers.
We will take care of all of that for you.
Okay.
You have other worries. Let us be worried about those problems.
Sounds like a winner to me.
Okay, well, any other question for me?
Best news I've ever heard.
Okay, you have a good day.